Hi, my name's Laura Mohan. I'm a social worker at Children's Comprehensive Care Clinic in Austin, Texas. We're part of the Dell Children's Medical Group, or Ascension, Texas. And I was asked to speak to you all a little bit today about Medicaid waivers. So we're going to try to keep this brief. I definitely won't be able to cover everything for Medicaid waivers, but my goal is to give you the context of other services that the Medicaid waivers fall into, what they are, what they offer, and how to get connected to their interest lists. So let's go ahead and get started. So Medicaid waivers, in the context of what other services, how they all fit into that puzzle of services for children with developmental disabilities, you have to know a little bit about Medicaid, the insurance, before you start talking about Medicaid waivers. Because Medicaid waivers have very long interest lists to get on, I don't want families to be discouraged that, oh, I have to wait 10 years, 15 years to access any services for my child, because there are some services that you can access while you're waiting for those Medicaid waivers. With the most important piece of that being the Texas Medicaid. For children that have disabilities or chronic health conditions, there's a couple of different categories under which they might qualify for Medicaid. There is the general Texas Medicaid that any child whose household is below a certain income can qualify for, but then there are some Medicaid categories that are very specific for children that meet that Social Security disability criteria. So that would be Social Security, SSI. For SSI, you have to meet their disability criteria as well as be below a certain threshold for the household income. Unfortunately, that really is very low, so a lot of people don't qualify for it. But if you do, it gives your child access to Medicaid as well as a monthly benefit or stipend to help pay for their daily needs. The next kind of category up is Medicaid buy-in for children. They actually have a buy-in for adults as well. But if we're talking about children, it's the Medicaid buy-in for children. And so you also have to meet the disability criteria that is set by the Social Security Administration. But it allows you to be above the household income requirement for SSI. So if you're above that income requirement for SSI, but you're below 300% of the federal poverty level, you could qualify for the Medicaid buy-in for children. The way to find out what the federal poverty level is for your household, you could simply Google the year, and so like it's 2017 federal poverty level chart, because you will look at not only how many people are in your household, but then your household income to determine whether you fall under that. Or you could talk to a case manager that you're connected to and they should be able to help you with that. Up to 300% of the federal poverty level, you could access Medicaid buy-in for children or for adults. The reason that's important is that it can connect you to Medicaid. Medicaid could be used as a secondary insurance if you have maybe an employer-based insurance that your child is covered under. It could qualify you for the HIP program, the Health Insurance Premium Payment Program. That would help pay your premiums and deductibles for your employer-based insurance. It would connect you to the Medicaid Transportation Program that could help pay for the cost for medical transportation for your child. It could also connect you to personal care services or consumer first choice services that would be attendant care for your child. So all of those things are services that you get access through Medicaid, and it doesn't require a waiver to get them. So I always want to make sure that families know about those. The next category to access Medicaid without meeting the criteria for SSI or for Medicaid buy-in would be through the Medicaid waivers, which is one of the reasons that it's so important for families. Medicaid waivers allow, if the child qualifies for Medicaid, they only look at the child. They will not look at the rest of the household income in qualifying that child for Medicaid. So they not only get the benefits and services of the waiver, but they also get access to Medicaid, the insurance, and that they keep that access to Medicaid as long as they're on the Medicaid waiver. I promise we will be getting back to some of the Medicaid waiver information, but I also, again, want to give you a little bit more context of other services and supports that your child might qualify for. The other service would be through your local authority. The local authority is a community-based organization in your area that provides mental health and services for people with intellectual disabilities or developmental disabilities in the community. So they're community-based services. Texas is a large state, and so it's not one state-run organization. It's a nonprofit that utilizes state and federal funds to provide services. Therefore, each area has a different organization. And for the Travis County area, that would be Integral Care, formerly known as Austin Travis County Integral Care, or ATCIC. In this past year, they've changed their name, simplified it to Integral Care. The local authority has, like I said, mental health services, as well as what they call the IDD, or the Intellectual and Developmental Disability Services. So those programs really can run very separate. So if you have a child that would qualify for both categories of services, it's just important that you identify that for the organization so that they get you kind of into both programs and both tracks. One of the Medicaid waivers that we'll talk about today is housed under their mental health services, and so if that's one that you might your child might qualify for, or you might qualify for, it would be very important that you kind of identify and get connected to that aspect of their program. For the local authority, for their IDD services, their Intellectual and Developmental Disability Program, they do have eligibility criteria similar to that for SSI. So, meaning that you do need to meet a disability criteria. They do include an IQ cap on that. So, if you are above 70 to 75 on the IQ score, they may tell you that you don't qualify for their IDD services. Unfortunately, what that does is it also disqualifies you for two of the Medicaid waivers that we're going to talk about that the local authority manages. The other aspect that they look at for services through your local authority is that they do provide services on a sliding scale. So they will look at the household income. Those income cutoffs are much higher than that of Social Security. So it is definitely, if you are a middle income household, it is still worthwhile for you to go to them and find out what, if any, copay you might have for their services. The type of services that they provide are respite or specialized childcare. They have some behavioral management or supports that they can provide, as well as case management. And then they also are the organization that manages the intermediate care facilities, are the state's group homes. So depending on if you have a copayment at all, or how much your copayment is, it may be worth it. It may be less than what you would pay out of pocket for a caregiver if you weren't utilizing their services at all. So that's something to consider. That's just a general context of kind of where the Medicaid waivers fit in to other services that are available. But what exactly are the waivers? It's government funding for long-term services and supports to support people to remain in the community. Historically, individuals that had developmental disabilities didn't remain in their communities. They lived in group home or institutional settings, and there really was a recognition from the government and the federal government that no, they belong in their communities, and that families need support for them to stay in their communities and stay in their homes. And so that's where the Medicaid waivers came from. Unfortunately, in the state of Texas, there is only a certain amount of funding, so a certain number of slots, which has created long interest lists for these programs. And so as I talk about the different waivers, if I'm familiar with how long those interest lists currently are, I will let you know. So like I mentioned, waivers really waive off more restrictive settings, such as a nursing home or a group home. Enrollment in the waivers allow you to access Medicaid for the person receiving the waiver, only looking at that individual's income. So if this is a minor, if it is a child whose family's household income disqualifies them for some of these other services and supports, if they meet eligibility criteria for the waiver and they meet the child meets eligibility for Medicaid through their income and assets, then they are able to access the waiver. I can't get into a lot of detail about this just for time's sake, but that is why it's really important that if you are saving for your child and have accounts, savings or checkings accounts with your child's name on it, I really encourage you to talk to a financial planner that is knowledgeable about the special needs population, so that they can help you navigate how to save for your child and keep them eligible for different government benefits that they might be able to access, such as the Medicaid waivers.
All right, you're good to go.
So there's several different Medicaid waivers to be aware of. Each of them serve a slightly different population, may have slightly different eligibility criteria. So I'm going to go over all of them briefly and try to highlight the different services that might be different from what other Medicaid waivers provide. I'm going to start with the one that is really primarily for children. There's only one other waiver that has an age cutoff, but I'm going to start primarily with the one that's for children. That is the Medically Dependent Children's Program. So just as the name states, the eligibility criteria for that is that you're medically dependent and that you're a child. So you need to be 20 years or younger, and you need to have a nursing level of care need. So that could mean that they have a G-tube which they receive their nutrition through, or maybe other medical devices that help them. But that nursing level of medical necessity is a requirement for the waiver. Another requirement is that the child does live in a home environment, that they're not living in another kind of institutional setting. So some of the services that MDCP, or the Medically Dependent Children's Program, can offer is what's called flexible family supports. Really think of that as having a nursing level of care provided in your home, or an attendant. That could be somebody that is provided through consumer-directed services. That is someone where you take on the responsibility to manage that person. There is a financial management organization that you work with to cut the checks, to utilize the MDCP funding to pay for that staff, but you have taken on the responsibility to locate the staff, provide management to them, and ensure that that financial organization is helping to pay them. So MDCP can cover things like adaptive aids. So everything that Medicaid waivers cover have to be, it's a payer of last resort. So that would mean that if you have a private insurance, that the private insurance has not covered it, that you've also gone through Medicaid, the insurance that the child has because they have the Medicaid waiver, and Medicaid also doesn't cover it. So you have to attempt to get it through your insurances first, have that denial, and take the denial to your Medicaid waiver case manager and say, now I'd like to use my MDCP funding to purchase this specialized seating equipment or whatever the case may be, whatever adaptive aid it is that you feel that your child could benefit from. They can also cover respite services or that attendance support that we talked about. Also minor home modifications. That could be a bathroom remodel. That could be a ramp into the doorway. That could be widening door frames to allow easier access in and out for someone using a wheelchair. They also provide case management and transition services. The case management is provided through your Star Kids Medicaid health plan that you choose. So some services that MDCP do not offer are behavioral support services or specialized therapies. We'll talk a little bit more about what specialized therapies are when we talk about the class waiver. MDCP also has a special program in which you can get to the top of the list. MDCP currently has an interest list of about 8 years, but if you meet certain medical fragility criteria, you are able to kind of create your own slot. You're not taking a slot away from somebody else who is sitting on the interest list. What happens is once Health and Human Services has reviewed medical records and made the determination that yes, you do meet the medical fragility criteria to use this money follows the person process, you have to complete one overnight nursing home stay. You can stay with your child during this overnight stay, but that sets it up so that it is your child moving from a nursing home back out into the community, and therefore that money is following that person back out into the community. And so in that way, you're not taking a slot from somebody who's on the interest list. You're kind of creating your own slot. They do have very specific criteria you need to have to meet those to be able to utilize money follows the person. So definitely, speak with any case manager or talk with Texas Parent to Parent about whether you would meet that criteria. Some of those are if you need 24 hours a day oxygen support, or you are ventilator dependent. Do you have TPN or 100% of your nutrition through a G-tube? Do you have a tracheostomy, or do you have daily recurrent seizures that need medical intervention to stop? Those are some of the criteria to qualify for the MDCP money follows the person. So the next waiver that I'd like to talk about is CLASS. It's Community Living Assistance and Support Services, CLASS. That is managed by the Texas Department of Aging and Disability Services. The eligibility for that is that you have moderate to extreme deficits in adaptive behavior. So this particular waiver is one of the only ones that doesn't require an intellectual disability to qualify for services. So this could be for an individual that has cerebral palsy but does not have an intellectual disability, or someone that perhaps has a traumatic brain injury but doesn't meet that intellectual disability criteria but still has some physical support needs. The person must be living in their own home or in their family home, again, not in a more institutionalized setting or group home. So what makes CLASS unique is that they really focus on providing what's called specialized therapies. Your occupational therapy, speech therapy, physical therapy, those are all therapies that are traditionally funded through your insurance. And by having Medicaid through the waiver, Medicaid would definitely cover those therapies. So what the specialized therapies really are that CLASS provides could be aqua therapy, could be that horse therapy called hippotherapy, it could be massage therapy. There's music therapy and recreational therapy. So more of these kind of more fun therapies that your child might want to participate in, and that definitely can provide a lot of benefit and improve quality of life. Those are all therapies that are covered and provided through class. Additionally, class can also provide case management, some behavioral support services, adaptive aids, and minor home modifications similar to MDCP. And cognitive rehabilitation therapy is another one of those therapies that it provides. The next Medicaid waiver is called Deaf, Blind, Multiple Disability Waiver, or DBMD. I'm not going to spend a lot of time going through that waiver. It is a very small population that it serves, but you do have to have a visual impairment, a hearing impairment, and other disabilities to qualify for it. There is a intellectual disability criteria for eligibility for this one, and they really specialize on providing services for individuals that are deaf-blind that are just very unique to that population. So it's a wonderful waiver for those that need it, and because it targets such a specialized population, typically the interest list for this is fairly short. I think the last I heard it was about 5 years. The next waiver is the YES waiver, or the Youth Empowerment Services waiver. This one is unique in that it is the only one that is really targeted towards behavioral health or mental health services. So this one is managed through the behavioral health or mental health department of your local authority. For Travis County, that's Integral Care. The eligibility for that is that you need to be a youth between the ages of 3 and 18 to qualify for the program. You have to have a serious emotional disturbance. Typically that includes a recent history of psychiatric acute hospitalizations or significant risk for another acute hospitalization. And you have to be living in the community, because again, the waivers are to waive off a more restrictive environment. So the goal is to provide additional supports and services to allow someone to remain in the community. With the YES waiver, that can include things like community living support, specialized therapies similar to the YES waiver, or to class, family supports, employment assistance, adaptive aids, minor home modifications, non-medical transportation, and transition services. I don't know for your area how long the YES waiver interest list might be. I really haven't heard from families about how long they've been on interest lists for the YES waiver. And this is a relatively new waiver compared to some of the other waivers that are out there. The last two waivers that I'm going to discuss are also managed by your local authority. So that is the Texas Home Living Waiver and HCS, our Home and Community Services. Home and Community Services is a really important waiver to get on the interest list for. Similar to class, it serves into adulthood, so it can follow you for the rest of your life. But it also provides some services that class does not. Where class really focuses on those specialized therapies, HCS really targets funding for residential support. So even if you are, say you have a very young child and you're thinking, oh, I never plan to put my child in some sort of residential setting. They do have some unique ways to fund for residential support that allow your child to stay at home. So please don't discount it just because it provides the residential services. There are some ways to help you keep your child at home and still provide funding for residential support. So with HCS, there is that intellectual disability criteria, as well as deficits in adaptive functioning is kind of what the definition says. Once you are enrolled, you select an agency to provide the services similar to the other Medicaid waivers. It can provide behavioral support services. Once you are an adult, it can help fund for those traditional therapies, occupational speech, physical therapy. It can provide cognitive rehab therapy. It can fund day program or day habilitation programs, as well as minor home modifications, transportation, adaptive aids. One of the other things that happens is for adults on Medicaid does not pay for preventative dental care, but the Medicaid waivers do. So HCS also provides that preventative dental services for adults that need it because the adult Medicaid no longer covers it. Texas Home Living is the last Medicaid waiver. It is also managed by your local authority. It is similar in what it covers to some of the other Medicaid waivers: minor home modifications, adaptive aids, day hab and respite. It can fund for behavioral support. The funding amount for Texas Home Living is not as high as some of the other Medicaid waivers. I like to call it a light waiver. I'm sure the state doesn't like me saying that, but it really is. It is a stopgap waiver. It does fund for extra supports and services. It can be wonderful when you have it, but it is not a place to land and stay. With these Medicaid waivers, you can go on the interest list for all of the Medicaid waivers. They do not determine eligibility until you come up to the top of the list for the waiver. Only receive one Medicaid waiver at a time. So what happens is, because each of them have different interest list time frames, say your child meets the criteria for MDCP. So you've done 7 to 8 years on the interest list, and you get the call saying, "Hi, your child is up at the top of the list for MDCP." You do the process to enroll. Your child receives MDCP Medicaid waivers for several years. And then you get another call. You say, "Hi, your child now qualifies for class Medicaid waiver. Would you like to switch over?" That's when it's really important that you really compare and contrast the two waivers, what they provide, the cost benefit of class will serve adults. MDCP ends when your child turns 21. So how close is your child to turning 21? What type of things are you really needing? Are you really needing that nursing level of care, a nurse that can come in and provide services? Or is your child maybe not needing that level of care anymore, and what they really need are access to some of these specialized therapies? So really weigh those two things. Talk to case managers, talk to Texas Parent to Parent, talk to resources that you know and trust to try to figure out which one you want to go with, because your child can only receive services from one Medicaid waiver at a time. So it may be that your child receives services from different waivers throughout their life. It's all going to depend on really that individual's needs and what eligibility criteria they meet. So those are things to consider when looking at the Medicaid waivers. As for resources, you've probably heard me mention Texas Parent to Parent several times throughout this talk. They are a fabulous organization. They are a group of parents that have walked the walk and talked the talk. They have experienced these things, and so they are a wonderful resource to connect to other parents, to get on listservs, to ask questions, to gather like real life information about, like, I know that this is on paper the way the process is supposed to work, but what's been your experience, or what are these little details that you really need to know to be able to access and maximize your services. They are a wonderful resource for that. Also connect with your local authority, and even if you do not qualify for those services and supports, those programs that they can offer you while you're waiting for a Medicaid waiver, you can definitely utilize them to get on the Medicaid waiver interest list in the meantime. And then also disability-specific programs that you might be involved with. If it's Hope for Minds, if it's the Down Syndrome Association, whichever disability-specific program it is, based on kind of your family's situation. I really encourage you to connect to those other individuals that are experiencing the same things or having to navigate those same services and programs that you are. I will also be including a PowerPoint on some of the programs that we discussed. That PowerPoint will include the phone numbers for all of these waivers that we've talked about today. Several of the waivers fall under the same number. So for the local authority, that could get you connected to HCS, to YES, and to Texas Home Living. MDCP class and DBMD are all managed under the same phone number as well. So it's one interest list, or it's one entity that manages all of those interest lists. The other important piece that I'd like to remind you about the Medicaid waivers is that because they are having to manage long interest lists, it is very important that you notify them of any changes in your contact information. If your phone number changes, if you move and your address changes, it's important that you contact them and let them know. I also would really encourage you, whether it's your birthday month or you connect it to maybe your Medicaid renewal time period, find something that's meaningful to you and kind of add to the list. On this month, I also have to contact these organizations that are managing the interest lists and let them know, hey, yes, my contact information is still the same. Yes, we are still interested in this program. And hey, by the way, what's my child's, where are they on the interest list? It periodically, annually, they will contact you to see if you are still interested. If for some reason you don't respond to them, they can remove you from the interest list. So I would hate for you to have to start over because of a loss of contact. So please just make sure that you are at least annually checking in with these organizations to let them know, I still am interested in this service. Please keep me on the interest list. All right, thank you so much for your time.